health officials say everyone who wants a vaccine will be able to get one by late spring or early summer.
By the time we get to several months into this year, we will have enough people protected that we can start thinking seriously about the return to normality.
So that means you can't just go to your doctor or pharmacy and get one right away. This process is going to follow a pretty specific order laid out by the CDC and local governments. First up, in Phase 1A, the 21 million healthcare workers. That, of course, means doctors and nurses, but also the other people who make sure our healthcare system stays up and running, like cleaning staff, cafeteria workers, and nursing home aides. And speaking of nursing homes, the first phase will also include the 3 million residents of nursing homes and long-term care facilities. Some of those 24 million people are getting vaccinated right now, and Operation Warp Speed officials have said they can distribute 40 million doses by the end of the year. But remember, both the Pfizer and Moderna vaccines require 2 doses, so this will cover about 20 million people, meaning Phase 1A will definitely continue into January. Who's up next will be decided by state governments and the CDC, but Phase 1B will most likely be essential workers. About 87 million Americans work in industries that are vital to keeping the country afloat. These workers are more at risk for COVID-19 because they can't work from home. Essential workers are also disproportionately from Black and Latino communities that have been hit especially hard by the coronavirus. And who is considered essential also depends on where you live, so a lot of this will be up to state governments. For example, states like California and Arizona might decide to prioritize farm workers. Somewhere like Idaho might consider food processing workers, while in Kentucky, grade school teachers could be prioritized. Phase 1C will likely be high-risk adults. 100 million adults have underlying health conditions that put them at a higher risk of getting seriously ill with COVID-19. Think diabetes, cancer, obesity, or kidney disease. Another at-risk group, adults over the age of 65. That's about 53 million people. After these groups are vaccinated, 264 million people, that's when shots will be available to healthy adults. As for kids, Moderna and Pfizer are testing their vaccines on children as young as 12 right now, so we don't know where they'll fall on the timeline just yet. How you'll get the vaccine once it's your turn is still being worked out too. But most likely it will be like getting your flu shot through your doctor's office or at a pharmacy like Walgreens or CVS. Of course, these vaccines could not be coming at a better time. Experts say we're in for a really tough winter. If this timeline holds, everyone who wants a vaccine could have one by May or June, which means a hopeful spring is right around the corner.